Hey, good morning, Honorable Board, Chair Lopez. I'm Gary Millay from the Office of Emergency Services. I'm joined by Dr. Moreno and Dr. Walls. I almost said Dr. Gray for a second. I apologize. We're going to talk to you about what has been in the news very recently, the coronavirus, and specifically what the county is doing to reassure not only the board but the public that we are managing this to the best of our ability and providing the most accurate and current information and guidance to our public residents. I'll start with the Office of Emergency Services. We are enacting the 4 functions that we do for any kind of a crisis: planning, emergency preparedness, public information, and EOC management. Specifically with planning, we have pandemic plans that the county is enacting, and we are following those to help us prepare and collaborate and coordinate with the different health and local state agencies that are required to manage this crisis as it increases within our county. We are developing emergency preparedness messaging for the public and for our county partners so that we are consistent in what we're putting forth, that the information is accurate and timely, and that not only the board but the public has the confidence that they can seek that information directly from the county, and it can be shared with anybody that has a right to know that information. The Office of Emergency Services is responsible for the public information and alert and warning, and we are collaborating with our partners in the health for the county and the state so that we have the current information to share with not only the board but with the community at large. And lastly, the EOC management, we are activating our Emergency Operations Center to its level 3 capacity so that we can further collaborate and coordinate not only the actions that need to be taken in the preparedness, but in case this crisis that is at the very, very incipient stages does begin to increase and impact the County of Monterey in a much broader sense. We are forming through the State Emergency Management System the Joint Information Center, which we will bring in the communication experts from all of the county entities involved, including the state health and Cal OES, so that we can coordinate a consistent message that is easy to understand and provides specific direction to the public of what not only to expect, but actions that they can take to protect themselves. With that, I'll turn it over to Dr. Moreno to talk about specifically what the health department is doing to manage and what their responsibilities are.
Do you want to present on that stuff?
I already talked about that.
There we go. All right. All right. All right. So good morning, board. So within the context of the countywide preparedness and response plan that Gary laid out, I want to provide a background on the specific event, novel coronavirus, or known as COVID-19. I'll then talk about public health, how public health has planned for this and similar events. And I also want to share with you the response strategies to date, which are attempts to contain COVID-19, and finally describe future response strategies as we move from containment of the virus to mitigation of the virus, and that is what we do to minimize the impact of this virus on our communities once we have community transmission. Thanks. So coronavirus is just some background, coronavirus is that we're experiencing is a genetic mutation, has a genetic mutation that has allowed it to transmit from animals to humans. The symptoms include fever, shortness of breath, and some patients don't have any symptoms at all. As you know, the first cases were detected in China, and according to the World Health Organization this morning, globally there's over 88,000 cases with a little over 3,000 deaths, again, per the World Health Organization. And the numbers are changing every day, sometimes more than once a day. Most recently, according to the CDC, in the U.S. we have a total of 108 cases with 6 deaths. Specifically, 48 of those cases were individuals repatriated from high-risk areas of the United States, and now 60 cases have been confirmed or have the presumptive diagnosis of novel coronavirus in the U.S. Of those, 17 were travel-related, 26 persons were had person-to-person spread, and there has been at least one individual who had no travel to China or a link to a case. Go ahead. All right. So, public health preparedness. Our health department has been planning for this type of event for some time. We have an emergency operations plan for the department, continuity of operation plan. We have a pandemic flu plan, an epidemiology and surveillance plan, and a contact investigation plan. And these are all aligned with your Department of OES overarching emergency operations plan. Our department has been training and exercising on these plans, and we have actually implemented these plans in the past in our response to H1N1 pandemic flu, SARS, severe acute respiratory syndrome, MERS, Middle East respiratory syndrome, and Ebola virus. So we have responded to similar events in the past. As a public health department, we have been hosting our healthcare coalition and other coalitions where we have meetings to discuss emerging infectious disease preparedness and response with our hospitals, our skilled nursing facilities, surgery centers, and dialysis centers. And public health currently works on a daily basis between events such as these on suspected disease outbreaks, which include our conducting screening, diagnosing, isolating, and identifying people that have been exposed. And one example would be tuberculosis in our efforts to prevent tuberculosis outbreaks. And in addition, our public health laboratory works daily with viral pathogens, so very experienced working with viruses like this one. Next one, January, yes, thanks. So our initial efforts have been to contain COVID-19. And in January, we issued our first health advisory to our healthcare providers in Monterey County, recommending that hospitals and clinics initiate screening and isolation of patients at risk for COVID-19. We also issued guidance for the hospitals and their staff to use appropriate PPE, personal protective equipment, to prevent exposures and spread of the disease within our hospitals and clinics. In mid-January, we identified our first Monterey County resident that met the CDC Person Under Investigation, or PUI, criteria. We continue to work with healthcare providers to collect specimens from these individuals for testing, and we transport them to our public health lab, and then from there we've been transferring the specimens to the CDC for testing. We will soon be sending lab test specimens, to the Santa Clara County Laboratory and also to the state Bioreceptor and Disease Laboratory now that they have test kits and can run the tests. And if an individual in Monterey County is positive for COVID-19, that person will be, we will isolate that individual. Health will begin contact investigations to identify people exposed to the person with COVID-19, and the department will test, monitor, quarantine, and isolate that individual as warranted. That would be in order to reduce exposures to other people and in an effort to identify any new cases should they exist. Next, thanks. In early February, we began monitoring our first few county residents that traveled to high-risk parts of the world in the previous 14 days in order to check them for symptoms of coronavirus. If they become symptomatic, we instruct them on how to seek medical care, and we would do so while also alerting the providers, whether that be an urgent care or emergency department, so they can prepare to accept a symptomatic traveler into their emergency department. We have received approval from the CDC to receive the test kit for the virus, We're waiting for that test kit. We've also made a request to the CDC to get another test kit where we would actually have to validate it. The benefit of having that is that if we have that test kit, we could have some local discretion as to who gets tested. But currently, we can only test individuals that the CDC has approved for testing. And we continue to participate in ongoing national, state, and regional calls with HHS, the CDC, Homeland Security, your State Department of Public Health, Emergency Medical Services Agency, Cal OSHA, and health officers and health directors in California. This is just to give you an example of the different agencies that we've been working with for the last couple of months in providing guidance and answering questions from multiple sectors of our community. We have been able to provide guidance, but also reassure some of these agencies that have already prepared as well. Some of these agencies already have opened up and reviewed their continuity of operations plan, and they've looked at alternative methods to conduct business to minimize the potential spread of coronavirus in their organizations. So I want to move now to how we communicate as a health department with the public and our partnering agencies. Today's presentation is an example. We also rely on all media types and messages from California Department of Health, and we also rely on messaging that's coming out of the Centers for Disease Control and Prevention. What we try to focus on in communicating to the public and to our partners is what we know and what we don't know about the situation. And if we don't know, we're not afraid to admit that we don't know what we don't know at this time. We also focus on what the county and and public health are doing about it, and what, as much as we're able to, what the risk is to the community, and if there are any special groups, what are the risks to them. At this time, as you've heard, the risk continues to be considered low in the United States and in Monterey County. We also know that more critically ill patients older adults with chronic medical conditions tend to incur more critical illness than younger individuals without chronic medical conditions. Thanks. Oops. Yes, okay. And we also communicate with the public and our partnering agencies on what they can do to protect themselves, their employees, and those that they serve. So I always want to start with the importance of getting a flu shot. At this point, we don't have any coronavirus, but we do have people who are sick who are showing up to emergency departments and their healthcare providers. If you haven't received a flu shot yet, I highly encourage you to receive a flu shot, because if you can avoid getting the flu, you may avoid an unnecessary or a preventable visit to the emergency department. So very important. Fortunately, the measures that prevent the spread of influenza, protect yourself from getting influenza virus, are the same recommendations for COVID-19, which is wash your hands, avoid touching your face, sanitize commonly touched surfaces, avoid sick people, and if you get sick, please stay home. It's important for individuals to call ahead to a clinic or emergency department if they're ill and have traveled to countries with high rates of COVID-19, or they themselves have been in contact with a person who's been confirmed to have novel coronavirus. This is so that the receiving emergency department or urgent care can be prepared to protect themselves, the staffs, and from possible exposure. We also encourage our communications to our partnering agencies that they check with the CDC website for travel advisories. We think of ourselves as traveling perhaps for pleasure, but there are businesses that have business needs to travel abroad, and so it's really important that those businesses always take measures to protect their employees against unnecessary travel to regions that the CDC has determined to avoid unless absolutely necessary. We also encourage them to review their emergency operations plans and continuity of operations plans and surge plans, and many of the organizations that have called us have already done so. We ask also that they check the CDC website for updated sector-specific guidance. The CDC and California Department of Public Health have issued sector-specific guidance, for example, for schools, for daycares, for businesses, and for healthcare facilities, just to name a few. And this is my last slide. I just want to mention briefly what the our future response strategies will be or may be. They will be efforts that will move us from containment to mitigation. mitigation being those measures that we take to reduce the spread of the virus once we have community spread here in Monterey County. So we discuss options that mitigate the impact, such as social distancing. This is one example I'll give you this morning. Social distancing, if necessary, is intended to keep as much distance between individuals, sick or not sick, so we reduce the spread. Things that we actually have had conversations, for example, with our local schools, the Monterey County Office of Ed, and others include opportunities for businesses to look at ways that their employees can work from home, particularly if they're sick but don't have time on the books to take annual leave. Is there an opportunity to work from home? Excluding sick students, employees, and customers from schools and businesses. Closing schools and businesses if necessary, and canceling large social gatherings and restricting movement of groups. We also, and again, these are just discussions with our partnering agencies. Finally, we continue to work with hospitals, clinics, and ambulance services to provide high-quality care to those who need it in Monterey County while still protecting healthcare workers and other patients. So thank you, and I'll pass it over to Dr. Walls. You got it? Okay.
Good morning, Mr. Chair and Supervisors. My name is Dr. Craig Walls, and I am the Chief Medical Officer of Natividad. Just like to start off by saying that you have one county hospital, but you have 4 hospitals in your county, and as you well know, and these are excellent facilities, and I can tell you that as we move through this period of time together, these hospitals are essentially linked at the arms. We're meeting. We met yesterday. We will continue to cooperate and assist one another with best practices and other things. So I'm going to go quickly, and I just want to talk about people, places, and things in regard to Natividad's preparations. So all the hospitals have infection preventionists. Infection preventionists are expert in epidemiology of infectious disease and how to mitigate against it and prevent its spread. You can also be reassured that you have a very committed, mission-driven staff at Natividad, which I think you already know. As you've heard, we have input and communication channels open with both federal, state, and county offices, and we're partnering closely with the health department, EMS, OES. Hospital preparedness planning is a consortium of hospitals which meet all the time, not just in the face of COVID-19, and allows to share best practices, coordinate on equipment, and a variety of other things. And Sheriff's Office as well, and I've left out, I'm sure, many valuable other partners. So places, we are coming up with plans and seeking the appropriate regulatory approvals for alternative treatment areas should we need to deploy those. We do have negative pressure rooms and spaces within our hospital that allow us to isolate and remove air and droplets out of that room. Things. Personal protective equipment is going to be crucial with COVID-19. At this point, there's no specific treatment. The treatment for folks that have it is supportive care. So preventing transmission is crucial. We have personal protective equipment. We have good personal protective equipment. We have strong standards of how and when to use it. It is kept in a protected, secured area and monitored. So I think we are doing quite well with personal protective equipment. We are continuing. We always are training. So I don't want to make it sound like we just started training. We're always training for disasters and in an all-hazards approach. When we train and practice for any emergency, it helps us with the next emergency that's coming down the road. So we also have a simulation center at Natividad where it allows us to simulate activities and interventions, and we will be utilizing those. to reiterate what my colleagues have said, we have pandemic influenza plans, and we keep those fresh, and we're looking at those every year. This is very, very similar. This is a respiratory virus with very similar signs and symptoms. So all the planning we've done in the past for influenza will pay off now and is helping us now. The CDC's provided a COVID-19 hospital preparedness tool, which is essentially a checklist that allows us to go through and see that we're on the same page with all the other facilities, both in the county and nationwide. There is some good news. You have a unified medical community. The hospitals are in communication with each other. We're in communication with the health department and others. We take our jobs very seriously, and we're going to help each other out. That goes without saying. We're very reassured at this point, to the best of our knowledge, that there is a low pediatric attack rate. So for those of us with kids at home, I find that very reassuring. We will see if that changes over time, but we have no reason to suspect that it would. We are developing mitigation strategies. So in a classic epidemiological response to an outbreak, first we start with containment. We try and contain the disease. Should we move to where there's now community acquired and community spread, we move into a phase of mitigation, which we discussed, social distancing being just one element of that. We're developing mitigation strategies now. We're not there, we're not deploying them, but we will be ready to deploy them as soon as we get the word. And lastly, this is potentially anxiety provoking for all of us. We see it. You can't not see it on the news. It's just constant. But I would like to remind everybody that Natividad's been around for 135 plus years. We've made it through an awful lot of epidemics and outbreaks, and we will make it through this one with our hospital partners and our other partners, as we mentioned. Now let's get back to work.
Thank you, Dr. Walls. Questions from the board? I see Supervisor Phillips.
You're right. There's a lot of angst, and we have a couple community meetings coming up to where we usually have public works and things. And the one thing we want someone from the health department there to
Sure.
tell us what the situation was. But I didn't hear you mention, are we going to have a hotline for this where people can call in and say, I have concerns, what do I do, what protocol, are we working on that, or is it in existence?
Sure. So, thank you, Supervisor. So we're in the process of opening up organizing our public information officers in order to coordinate and disseminate communication information in a variety of ways. Having a joint information center is key to that because it provides the structure by which all of us can come together to do that. So that is one option that we are definitely pursuing, a hotline where people can call in with questions, and then if appropriate, redirected to another resource that can answer further questions. We will also be looking at other ways to get information out. We have the I've spoken with the executive director for the Central California Alliance for Health, who's interested in working with us to get information out to their large number of contracted providers throughout the county. We're also looking at working with our hospital partners and some of our larger clinics to understand what are the mechanisms by which patients can currently call in for advice, either from hospitals or nurse lines or physicians on call, and try to utilize those as well. But the hotline is definitely something that the JIC will be on the JIC's agenda to pursue. Thank you.
Thank you. Yes, I also encourage you to contact United Way because the 211 system is already in place, and the information 211 is well known throughout the community as a go-to place for serious times. I did want to make a comment. My office has been receiving phone calls of concern, and I think people are starting to be hysterical about the cruise ships that are coming into town. And I know personally that the cruise ships are probably better screened and doing a better job of screening their passengers than just about anybody else is. So I have more concern, quite frankly, on the people who are arriving in San Francisco airport from some of the countries where there really is a lot of outbreak, who are not being screened at all, who get on a big motor coach and come right down to Monterey County and get off and eat in restaurants, et cetera. So while I think we might be vilifying the cruise industry to some degree, I quite frankly believe that they're doing a better job than many of the other elements of tourists and tourism transportation that visit our areas. So I'm hopeful that people will just take a look at this in a very logical way and to try to keep the hysteria at bay. And thank you for the efforts that you're making to ensure that happens.
Thank you. Yes, so on the cruise ships, could you talk about what we know about the one that is due to arrive soon, and who has the authority to say whether the passengers disembark or whether they have to stay on board, and what precautions may have already have been taken on that cruise ship?
Do you have information? That's really going to be good. All right. So yes, Supervisor Parker, thanks for the question. So I'll tell you what I know. I did have a conversation with the health officer for the city and county of San Francisco, because this ship was in their jurisdiction, or outside their jurisdiction in the ocean. So the CDC has had a role to play in tracking where cruise ships that are coming into ports and on harbors throughout the United States, and identifying those that may have had travel to regions that are considered to be high risk. What we found out from information on the website, and also speaking with the health officer of San Francisco, this one, and also from the assistant city manager for Monterey, that this particular ship has been an extensive cruise, but it's been primarily along the western coast of South America, Central America, and now North America. There is no indication that there is an outbreak of any illness on the ship, and that's what we know at this time. You had another question about jurisdiction. I think I'll briefly talk about my authority as the health officer, and then I can refer to county council in terms of what we know so far about authorities for individuals who are on a vessel but not actually in the county of Monterey. So within the county of Monterey, as a health officer, I can take any means necessary. When I believe there is a potential threat or a known threat to public health in Monterey County within the jurisdiction, I can take whatever means are necessary to prevent or reduce the spread of communicable diseases within the county. The question arises, what happens when the vessel actually isn't in the county, but it's just sitting off the coast?
Thank you. Supervisor Alejo.
Thank you, Mr. Chairman. I just wanted to just briefly make a statement and thank our staff for all their due diligence and preparations to reassure our county residents in Monterey County, and on our behalf as county supervisors, to also reassure our residents, is that we are taking this situation with all great seriousness, and that we are making all necessary preparations to be ready for any situation that may come ahead. It's important for our local residents, families, our children, and our seniors to understand that we have professionals on county staff that are trying to anticipate and prepare for any situation here where we might have one of our county residents be diagnosed with this. We know that in a state so large and with so many ports of entry, it's only a matter of time where we might have a situation where somebody is diagnosed in the future. But we are not waiting to respond or just to react to that situation. Rather, we're trying to stay proactive and be ahead of the game by utilizing all available information, getting information from how other counties are preparing, and also talking to our medical professionals, our doctors, our nurses, our public health specialists here in our county, that we are doing everything possible to prepare and be ready for any situation that may come ahead. So I'm glad we're having this forum here today to educate the public, and so that they also know that we are taking all necessary steps and that we're taking with all seriousness. So with that, Mr. Chairman, thank you.
Thank you, Supervisor. I apologize I got in front of Council's response.
Yes, thank you, Honorable Chair, members of the board. In my opinion, as long as a ship is in the waters of the United States or the waters of the state of California, the local health officer does not have jurisdiction to order a quarantine. That is within the jurisdiction of the Surgeon General of the United States or the California Department of Public Health. In addition, the City of Monterey operates the Port of Monterey and has jurisdiction over the landing of the tenders that would bring people to and from the cruise ship. Once on board, once on land rather, I would remind the board that a quarantine is a limitation on people's freedom. And the law requires that the public health officer have good cause to issue a quarantine. Based on the information we have right now, I don't think there's good cause. The information we have from where the ship embarked, San Francisco, is that there's no outbreak on board. There's no indication that anybody has coronavirus, much less any other disease. So that would be a risky road, in my opinion, to go down in advising the health officer. But that's my understanding of where the jurisdiction lies.
Thank you. And Mr. Chair, if I could, I just want to also thank the presenters and to thank the county. If you go to the county website, there's a big thing about coronavirus that pops right up on the homepage, and you can click on getting more information, and it lays out basically just the very simple things that we know from the flu that we can do to help keep us from, increasing our risk for coming down with the coronavirus. And it's all the things we know to do. And so if we do them, we're in pretty good shape. So thank you so much for making that. That's the kind of information I need. I'm glad you're going to protect us all, but what can I do? That's what I need to know. And so that's just really helpful. Just those simple steps of, washing our hands, wiping down those, the doorknobs and the light switches that get used by multiple people and that might have the germs lingering on there. And the hardest part for me, and probably for others as well, is I don't even realize how many times I'm touching my face with my hands. And so trying to make sure my hands are clean so that when I am touching my face without realizing it, I'm not increasing my risk of taking on extra germs. So thank you. Thanks for all your work.
On my behalf, I want to say thank you. And I know that I pushed to have this brought forward today so that our community had an understanding of what was happening, the way we're communicating between our institutions in terms of healthcare networks. But when we look at Monterey County as a whole and the things we face every day through our hazard mitigation plan with earthquakes, wildfires, and all the other things that could potentially go wrong, I don't think that it's bad advice to our community that they just look over their kit. At your home, you have a kit. What's in it? Batteries, water, blankets, the things you need, right? So now is a good time as any other just to make sure you're prepared should, again, any of those disasters strike. But one of the things I want to make sure we don't overlook as a county is our city partners as well. When we do have recommendations, when we do have materials, I want to make sure we're reaching out to them. Again, most folks look to local government in times of crisis, in times of questioning what's happening, and we want to make sure they're as informed as we are as a board and as informed as anybody else in the county about what the best measures are and what the latest status is. So while we could just direct them to a website, I think we need to have a stronger form of communication, perhaps through the CAO's office, to make sure that our city managers and elected officials in our cities have the latest as well and are prepared to speak to the issues that could arise. And lastly, I do want to ask a question about a declaration of emergency. I know the County of San Francisco, the City of San Francisco has not had a case yet. They've declared an emergency. I know Sonoma has had a single case. They've declared an emergency. What are the benefits, the drawbacks, and potential for that to happen here? And if we're not planning on that now, what is the recommendation for staff at this point?
Well, thank you, Chair Lopez. And in reference to the jurisdictions, be assured we right now and have for the last week hosted a weekly coordination call that all of the jurisdictions are on, and so they are getting the accurate information that we have, and so it's part of our shared collaborative approach. In reference to a local proclamation of emergency, That is certainly a tool that the county has in its toolbox to utilize if the need becomes. With the fact that we do not have any active cases at this time, the Office of Emergency Services is not recommending that we go that route, although it is something that we can always reserve for a later time if the situation does start to get more impactful to the county. The advantage of a local proclamation can be in lessening of restrictions and laws that are on the books that you have to follow as far as permitting processes and other different regulations. If the governor was going to proclaim a state emergency, the county would need to proclaim to be eligible for any kind of recovery funds that were made available to the county through the state or a federal declaration of emergency. And those are the two main advantages by actually proclaiming. I understand that other jurisdictions have utilized this tool to basically send a message to the state and to the president that hey, we have a problem. Although I don't want to cry wolf, so to speak, to the public. I don't want to proclaim a local emergency and make them think that there's reason to panic. That's not the case. We have a situation that we're dealing with, and we're dealing with it appropriately, and we're trying to make sure that the public is informed to the best of our ability. And if the time came where the situation increased to the point where we felt a local proclamation of emergency was appropriate, we would absolutely make that recommendation to the CAO and to the board.
Thank you. And then one follow-up for you, Dr. Moreno. So at this point, the latest and greatest is wash your hands, social distancing if you feel the need, but if you're sick, stay home. And if you feel the need that you might perhaps need hospitalization and are fearful that you may have, for some reason, come in contact with COVID-19, call ahead. Is that correct?
Very good. If I may have another minute or two. Sure.
Please.
So I think as we're putting together our messages, I think there are some fundamentals in putting together that message for the community. I think one is, my recommendation is if a person is concerned that they might have coronavirus, please do not go to an emergency room. Please do not go to urgent care and ask to be tested for coronavirus. We're not testing people who are requesting it at this time. If you are sick, as you mentioned, stay home, and specifically cough and fever. That's what most people are worried about with this coronavirus. But if you are sick with a cough and fever, regardless of the cause, it could be flu, it could be the common cold as well. Stay home, avoid contact with others, get plenty of rest, plenty of fluids, and over-the-counter medication. If your condition is worsening, call your provider to discuss your symptoms to see if you can continue to take care of yourself at home. If so, great. If your provider is concerned, then you may need additional medical evaluation and medical care. And then if your provider believes that you might have, I want to reassure people that if the healthcare provider believes that a person might have COVID, then actually we as public health have a conversation with the provider to determine whether or not it could be coronavirus and whether or not testing is required. But again, the two things, if you just want to get tested for coronavirus, please don't show up in an emergency room, please don't show up in urgent care to make that request. And if you're sick and you can take care of yourselves, please stay at home.
Thank you. At this point, we're going to open it up to public comment. And I see Mayor Oglesby here. Would you like to make public comment at this point? Or give you a little priority?
Ian Oglesby, I wasn't going to say anything, Supervisor, but I appreciate the opportunity. I was concerned, and I'm feeling a little bit more comfortable now that the briefing was done by county staff. But I did see the bullet points of the partners that they said they were talking to, and they did indicate local leaders. And I was wondering who they were because I haven't had that conversation. But it is a good point that they are having the weekly conversations with the city managers, and I'm sure the fire chiefs and our leads in the health area. But for some reason, that communication needs to filter out to the elected officials. Either, just clearly telling the city managers about how to relay that information to their partners so we can spill it out to the community. But I thought this was a wonderful briefing. I appreciate you leading it. I know a lot of communities have it on their agenda. I know Monterey is having one. I scheduled one, a briefing for Thursday, and I wanted to make sure I had a fuller background and understanding of what's going on at the county level. And if there's anything we can do at the city to bolster what the county is doing, let me know, and I'm sure the other mayors feel the same. But I want to thank the county board so much for having this, because we don't want to, and I heard the word used, panic, but panic comes from not providing enough information, not being clear and transparent, because we know we're going to have some individuals that get sick and unfortunately may pass away. But if we know what the procedures are, no matter what is happening along that train of events, we know that we will get past it and we will survive as a community. But the object is to let everybody know, because what we don't want to do is get to a point where the health managers say the schools should be closed, and then we don't know the repercussions of parents staying at home. City governments closing their local, community centers, the pools, the Oldemeyers and things of that nature. So that's an automatic. But I would like to be 2 or 3 steps ahead of any of those type of decisions and conversations. But that can only be done through your leadership as the board and the health administrators. So I want to say thank you guys so much.
Thank you, Mayor. Appreciate it. Any other members of the public wish to comment on this item? Please. And it's a 3-minute time limit. Sorry, I forgot to mention that.
I hope I can try to get this done in 3 minutes. Good morning. My name is Charles Lindbergh, and I'm a clinic physician for the past 25 years at the Monterey County Health Department. In the community clinic system, I currently work in East Salinas at the Alice Health Center. The clinic will see roughly the same number of patients any day as the emergency departments around us. Our clinic system includes a total of 7 clinics in Seaside, Marina, and Salinas, and serves a patient population of approximately 40,000, including many of the most vulnerable in our area. To be brief, we are moving towards an appropriate response posture regarding the COVID-19 situation. Although there are no completely foolproof models of this illness and its effect on the public, we are employing basic public health concepts aimed at prevention and, at the very least, slowing the spread of the disease in order to help prevent overburdening of the acute care facilities in our area. At the same time, we are working hard to figure out the best ways to maintain patient care for many others with chronic illnesses or pregnancy who will require regular contact with us in spite of a possible pandemic. Managing patients over the telephone, texting, isolated triage areas, and basic infection control measures will take the lead. Face-to-face clinic visits will be avoided unless they are absolutely necessary. Patient education materials and signage are being developed. Transfer of suspicious cases to receiving hospitals will be carefully coordinated with direct verbal communication between clinicians at both ends. We fully realize that we stand at the front line in this situation, where many people first interact with the healthcare system. We are preparing with the expectation that our patients will come to us for help and advice because they know us and trust us. We also know well that we are a source of help and guidance in areas of the county where we're more socially removed from the traditional methods of public discourse. If I may, I would like to digress a bit and give an overview of a couple things about my neighborhood, East Salinas. My clinic is located there. Although epidemiologists release numbers regarding what % of the population will likely contract COVID-19, I have heard roughly 60% recently. The distribution of these cases will not be evenly spread over the entire county. The disease will cluster in situations where contagion is most likely, in other words, in crowded environments. East Salinas is undoubtedly the most densely populated area in the entire county and should get some special added scrutiny for that reason. There are also a very high concentration of children in our neighborhood. In other places, schools have apparently been closed. In our neighborhood, closing schools mean parents not working, and not working for most of them means not getting paid. Additionally, most of the children would then be denied access to school lunches, which would cause significant stress in at-risk households. We also have many uninsured who will avoid the clinic care simply because they cannot afford it, which will tend to increase contagion and severity of presenting illness. Please consider these special issues when you set out to address the COVID-19.
Thank you for your comments. Any other members of the public? Seeing nobody coming forward, bring it back to this board. Additional comments, questions? Seeing none, thank you so much for this presentation. We really appreciate you bringing this information forward in a timely manner. Thank you. At this point, we're going to recess to lunch. Can I ask a quick question of my fellow board members? I know there's a special, is it a 2:30 meeting today for 4 Ord? Do you intend to step out for that, or are you going to be, okay. Trailer? Okay, so then we're going to reconvene at 2 o'clock, just to give us the time to handle the one item in closed session that we're recessing to now. Thank you.